Hello guys and welcome back to our channel CMS Prep. Today in this video we are going to discuss all the questions related to health planning, health management and health education or health communication asked in UPSC CMS from 2009 till 2024. We have about 20 questions, so let us begin. In a program, result analyze in comparison to cost is known as. So the correct answer is cost effective analysis. Why? In cost effective analysis, it compares the cost of different intervention with their effectiveness, that is the result or health outcome. For example, in NTEP, it saved 1.7 million people and it is determined with help of QALI, that is quality adjusted life years. So this is the correct one out. Management by objective is a type of qualitative management. In this, subunits and unit prepare their own plan of action. So it is out. In cost benefit analysis, results of a program are analyzed in terms of monetary benefits. For example, NTEP saved 12 million US dollars. So monetary benefit is seen. And in cost utility study, cost and benefits that impact both quality of life and quantity of life. It uses both DALI and QALY. In cost utility study, outcomes are measured in terms of quality adjusted life years, not just effectiveness. Okay, so the correct answer is cost effective analysis. Which one of the following management techniques help in standardizing the method of performing jobs? So systems analysis. Systems analysis is basically comparison of more than two cost effective alternatives in a health program. It is not related to standardization. Decision making is choosing among the alternatives and it does not standardize the work. Personnel management is a type of qualitative management. It deals with human resource, recruitment, salaries, not associated with task standardization. So the correct one is work sampling. What is work sampling? Work sampling is a systematic observation and recording of work activities of individuals in hospitals or other work environment. It is either predetermined or random. It measures how time is spent on various job tasks, helping in optimizing and standardizing job performance. Okay, so the correct answer is C, work sampling. Which one of the following is a quantitative method of health management? Cost effective analysis, yes, it is the correct one out. It uses quantitative data, that is cost and outcome, to compare interventions. HR management is a type of qualitative management. Communication management is strategy based, not numerical. And supportive supervision and leadership is behavior focused, a qualitative type of management, not quantitative. So these three are incorrect. Correct one is option A. Which of the following is not an quantitative method in management of health services? First one, network analysis. Yes, it includes all the activities and events and it is a type of quantitative analysis. Management by objective. This is the incorrect one. Why? Management by objective, in this subunit and units prepare their own plan of action and it is a type of qualitative technique of health management. In systems analysis, we compare the cost effectiveness of two or other alternatives in health program and it is a type of quantitative method of health management. Planning, programming and budgeting session. This is a type of quantitative health management technique. In this, zero budget approach is adopted. What this means is that no fresh budget allocation is done unless previous is zero. It helps in resource allocation to achieve objectives in the most efficient way. So these three are types of quantitative management and this is a type of qualitative management and hence is the odd one out and the correct answer. Consider the following management methods or techniques: system analysis, organizational design, personnel management, information systems. Which of the following methods are based on behavioral sciences? So the correct option is 2, 3 and 4. Systems analysis is more technical or quantitative management focused on optimizing operations. Organizational design, personnel management and information system focus on human behavior and interaction. So the correct option is 2, 3 and 4. The degree to which specific healthcare intervention achieves its objective when applied to a population is termed as. So the correct option is B, effectiveness. Why? Effectiveness is real world success of intervention in a target population. Sensitivity is diagnostic accuracy, not an health outcome. Efficiency is basically utilization of resources or output per input, not an outcome based objective. Impact, what is impact? Impact is the overall effect. It is a broader long term changes, for example morbidity drop, etc. So it is not the correct one. The correct answer is B, effectiveness. Match list 1 and list 2 with the correct answer. Bohr committee is responsible for 3 months training in PSM for doctors. Mudliar committee proposed strengthening of district hospital with specialist services. Kartar Singh committee mainly worked on replacing A&M with female health worker. It also proposed for male health supervisor. It proposed the norm for PHC, that is 1 PHC for 50,000 population. Okay, Srivastav committee mainly involved with developing a referral service complex, also with rural health scheme and with ROME, that is reorientation of medical education. So this is the correct. Match the following. Consider the following steps of a planning cycle. Which among the following is the best or the correct sequence of steps? So in health planning, the mnemonic is A or PIME. A for analysis, O for objective, R for resources, P for priority, P is for planning, I is for implementation, M is for monitoring, E is for evaluation. So the correct option is first we need to prioritize, we need to select the best program, then we operate the program, and after that we do the evaluation. So the correct option is 1, 3, 4 and 2. In the following table, the end results of planning are qualified by brief characteristics. How many of the pair are correctly matched? So there are 3 definitions. The first one is goal, objective and target. For goal, it is written that always constrained by time. It is incorrect. What is goal? Goal is the ultimate desired state in a health program towards which objective and resources are directed. It shows all or none phenomena. That means either the goal is achieved or not achieved and is not constrained by time and resources. So this is the wrong characteristic of goal. What is objective? It is a precise, specific, pre-planned end point of all activities in a health program. Precise, either achieved or not achieved. And target permits the concept of degree of achievement. Yes, what is target? It is the degree of achievement of objective within a specific timeline, and it is quantifiable. It allows degree, that is to measure it, how much of the objective is met. Only 2 pairs are correct. A series of meetings where individuals work within small groups to arrive at a plan of action for the problem under discussion is called. So the correct option is C, workshop. Workshops are interactive, action oriented, ideal for problem solving in small groups. Why others are incorrect? Group discussion, it is open talk and with no action plan. In role play, it is basically a stimulation technique. And focus group is mainly used in research or to collect opinion. So the correct option is C. Match the following. Symposium, so symposium is series of speeches on one topic. C. Panel discussion, it is discussion among the panelists. So 4 is the correct one. Workshop is action oriented, arriving at a plan of action to solve the problem as discussed in the previous question. And role play is situation is being dramatized. The following are group health education approaches except. So the correct option is option D, documentary. Why? A documentary is a mass media tool used to reach a wide passive audience. It is not interactive, so it does not qualify as a group education method which involves smaller face-to-face participatory session. Why other options are group approaches? Lecture delivered to a small or moderate size group with scope for interaction. In demonstration, it is live teaching of practical skill in a small group, for example ORS preparation, hand washing, etc. Role play, it is interactive and performed in group setting to stimulate real life situations. So the correct option is D. Which of the following is not a mass approach in health communication? Folk methods, yes, it is the correct answer. Traditional mass appeal. Poster, passive mass information is being displayed through it. Health exhibition is for public display, but role play is small group or individual play and not a method of mass approach in health communication. So the correct option is B. Consider the following statements. Symposium is a method of health education characterized by a series of speeches on a selected topics. Yes, it is correct. A presentation of different aspect of a topic by 3 or 4 expert. Yes, it is also correct. A discussion among the symposium member. This is incorrect. There is no discussion among the experts. The chairperson making a comprehensive summary at the end of the session. Yes, it is also correct. Which of the following statement is correct? So the correct statement is 1, 2 and 4. Direct mailing as a means of communication is an example of individual approach. It is incorrect. Why? Because individual approach would involve two-way personal interaction. Group approach requires a small group session. Mass approach, yes, it is the correct answer. Though email reaches individually, direct mailing is used to target large audience or large population, so it is grouped under mass approach in health education. Two-way communication, direct mail is usually one way unless feedback is actively taken. So the correct answer is option C, mass approach. All of the following are mass approaches towards education of general public except internet, yes, it is correct, can reach to large population. Direct mailing, yes, it target large group at once. Poster, billboards and sign, it is a classic mass media tool. But role playing, what is role play? Role play is an interactive group technique, not a method of mass communication. It involves few people acting out a scenario and usually limited to a small population. Okay, so the correct option is B. The attitude is a domain of. So what is learning? Learning is a relative permanent behavior change that occurs due to practice or experience. So there are three types of learning: cognitive learning, affective learning and psychomotor learning. And cognitive learning is associated with knowledge, affective learning is associated with attitude, feelings, emotion, values, etc. and psychomotor learning is associated with skills. So the correct option is affective learning. Temporal learning is not a recognized domain in health education. Affective domain includes feeling, emotion, values and attitude. Learning to respect patients, empathize with patient, etc. fall over here. So this is the correct option. Which of the following are domains of learning? So as discussed earlier, there are basically three types of learning: cognitive learning, affective learning and psychomotor learning. Cognitive learning is associated with knowledge, affective learning is associated with attitude and psychomotor learning is associated with skills. So the correct one is 1, 2 and 4. Which of the following are health education models? Medical model, yes, focuses on disease treatment and prevention. Motivational model encourages behavior changes through motivation. Social intervention model uses peer groups and social factor to influence health. So persuasion model is the odd one out here. It is a communication method, not a structured model used in health education. Okay, so the correct option is 1, 2 and 4. Which among the following are characteristics of health education rather than health propaganda? So before discussing, we need to discuss about health education versus health propaganda. Health education appeals to reason while health propaganda appeals to emotion. In health education, thought process is present, while in health propaganda there is no thought process. In health education, knowledge is actively acquired, while in health propaganda, knowledge and skill is instilled into the mind. The behavior is reflective over here and it is reflexive over here, and the processes acquired are behavior centric and here it is information centered. Okay, so this is the basic difference between health education and health propaganda. Now let's go through the options once. Knowledge actively acquired rather than instilled, yes, it is property of health education. It appeals to emotion rather than reason, this is the property of health propaganda. Behavior centered rather than information centered, yes, this is also property of health education. And arouses and stimulates primitive desire rather than disciplines them, this is a feature of health propaganda. And this one means like anger or greed, which are not a part of ethical health education. Okay, so the correct option is option 1 and 3. So guys, with this we have discussed all the 20 questions of health planning, health education and health management asked in UPSC CMS from 2009 till 2024. If you like this video, kindly subscribe to our channel, comment and follow. If you want to attempt the live quiz or want the PDF of this document, you can join our Telegram channel, which is mentioned in the description. Thank you and meet you in the next video.